Welcome everyone, good morning. And we're thrilled to have you here with joining us for our Life Sciences Venture Summit 2021. This is really exciting because it's a joint venture between the Bioscience Association of Maine and the Maine Center for Entrepreneurs. I'm Tom Rainey, the Executive Director of the Maine Center for Entrepreneurs. And I'm gonna introduce Agnieszka Carpenter here in just in a minute. But before we get started, I just wanted to give a little background on the Maine Center for Entrepreneurs and what we do and why we're involved in this. About a year ago, we received a large EDA grant to support the development of a bioscience cluster in Maine. And the goal behind this initiative really is to support technology commercialization among the research performing institutions around Maine and to work with startup companies and really to help get them surrounded with the right mix of resources to get them off the ground and pointing in the right direction. So there are two different initiatives that we're going to be talking about today, covering the various folks that are involved. And we're going to start with a fireside chat, really focused on the technology commercialization resources we have available here in the state. The second part of the program will be focused on the companies that have gone through our BioStartup program to date. And so I'll be introducing the moderators for that shortly. But first of all, I'd like to introduce Agnieszka Carpenter from the Bioscience Association and have her talk a little bit about how we've come together.
Hi, thank you, Tom. Yeah, I think at least half of you know me, but for those of you who don't, I'm Agnieszka Carpenter, Executive Director of BioME. We're Bioscience Association of Maine, a trade industry group devoted to creating opportunities for the life sciences community in Maine. And I'm also very excited that we are doing this event in collaboration with Maine Center for Entrepreneurs. It's been a long way coming. We have been planning this event for quite some time and had to pivot multiple times depending on what the situation was with, Delta, COVID, and whatever other letters came our way. But ultimately, we're here on Zoom, and thank you so much for joining us. We really focused on programming, wanting to make sure that we're providing a lot of value in the panel discussions and other talks that we're providing at this event. I just wanted to thank all of our members and all of our sponsors. Without you, we wouldn't be able to do what we're doing. And here's to a really good event. We're bright and early. This event is split between 2 days. So I hope you can join us for both mornings. Thank you.
Thanks, Agnieszka. So the Bioscience Cluster Initiative we launched about a year ago, as the name implies, the cluster of organizations that have come together that are all focused on advancing life sciences in Maine. And the strategy really was to align a service program very closely with existing incubators. It's sort of phase one. So there's a list here on the sponsors list, the Business Accelerator sponsors, the Union River Center for Innovation up in Ellsworth, MaineHealth Innovations down here in Portland, Tech Place in Brunswick Landing, and the University of Maine as one of our key sponsors and partners. And these organizations are heavily involved in supporting life sciences businesses. We've hired an expert here I'll be introducing here shortly, who's helping the companies that are in these programs succeed. But we're going to go ahead and jump into the fireside chat. And I'd like to introduce Greg Fryer, who's one of the attorneys that works very closely with the Maine Center for Entrepreneurs. Greg has been a friend of MCE for years, serves as our registered agent, is always willing to roll up his sleeves and help with mentoring with our companies, was heavily involved in an event that we did recently, a workshop that was specifically for the companies that are in the BioStartup program. So Greg has offered to come in as one of our attorneys from Verrill and support this program. So Greg, I'm going to hand the floor over to you.
Great. Well, thanks, Tom, and thank you so much for this event. This whole push toward bioscience and life sciences, I think, is really, really important for the state of Maine. When I came here back in the 80s, those were the days of Ventrex, Bob Foster's company. Soon leading to IDEX and and you'll hear this morning about MaineHealth and its in its growth. It's a massive organization now doing a lot of great work in this field, and so we have a lot of resources here in Maine. And I think the push toward life science and bioscience makes total sense for us. So this morning, for the next hour, we're going to have a conversation about technology transfer in Maine. What is it? Why is it important? How has it changed? I'm going to start with some introductions. I am a corporate lawyer with Verrill. That's a firm that started in Maine 150 years ago and now has major offices also in Boston and Fairfield County, Connecticut. I work mostly in helping businesses raise capital, address planning and governance issues, and handle complex transactions. I work with about 125 colleagues, lawyers at the firm, of whom many practice in the field of intellectual property. That's one of our very substantial subspecialties and rapidly growing. We actually, pertinent to today's conversation, we have 3 full-time patent lawyers on staff, which is amazing for a firm of 125, 130 lawyers. So we are very, very interested in this whole topic. With me today are representatives from Maine's largest healthcare system, Maine's largest university, and a longtime, very innovative Maine laboratory. Susan Ahern was hired in March 2020 as Vice President of Innovation at MaineHealth. She's a key player in MaineHealth's Innovation Center. Before returning to Maine, being a graduate of Colby College, she gathered extensive experience as a startup company entrepreneur, as a co-founder of Canada's first Canadian mentoring service in Boston, as a leader in Canada's innovative award-winning cross-border accelerator in Boston, and as a director of the Maine Technology Transfer Center. Renee Kelly has been supporting entrepreneurship and innovation at the University of Maine for nearly 20 years, most recently as Assistant Vice President for Innovation and Economic Development, where she leads all manner of economic development and business innovation support programs, all while finding time to teach graduate courses in innovation engineering. She's a graduate of Smith College. She also serves on the board of directors of one of Maine's leading banks, the first in Damascotta. In fact, if you spot her sneaking out a bit early this morning, it's to attend a bank board meeting today. Judy Sproule is Director of Strategic Initiatives at MDI Biological Laboratories on charming Salisbury Cove on the road to Bar Harbor. She spent years away from her native Maine, gathering a BA from Connecticut College, an MBA from NYU, and worldly experience from Goldman Sachs, and then a New York management consulting firm that's centered to Mozambique. After returning from Mozambique, she somehow persuaded that firm, that New York City firm, to send her to an even more exotic location, namely Trenton, Maine, again on the road to Bar Harbor. She did a stint with Jackson Labs and then was hired away by MDI Biolabs, where she's held key positions for nearly the past 8 years. All 3 of these organizations, UMaine, MaineHealth, MDIBL, they all have innovation programs at different stages of development. And so we thought it would be interesting to hear from the people who head up those programs, and we're fortunate to be joined by them today. So technology transfer, that's a term that means different things to different people, but I'm going to use it to describe an institutionalized effort to take research and turn it into commercial products. And in particular, not within one organization, but starting at a research intensive facility, and looking, looking for opportunities for a commercial development. It's more than an act of turning your bright idea into a business. It's more than creating an environment where startups can take root and grow. It's really a system for taking a group of people who are really good at academic and clinical research and encouraging them to keep an eye out for applications that could drive successful businesses. This is a bridge between 2 very different worlds, and it's way more difficult than you might think. So I'm going to start by asking each of our panelists here to talk about, your respective roles at the institutions that you help lead. I want you to take 3 to 5 minutes, acquaint us with some of the amazing work that goes on at your organization. And we'll start with Susan.
Well, good morning, everyone. And thank you, Greg, and Mishka, and Tom, for the opportunity to be here. And thank you all for being here at 9 in the morning. Again, I'm Susan Ahern, Vice President of Innovation here at MaineHealth. And the Innovation Division started in March of 2020, so we're just 18 months old. But what's really great is the mission for MaineHealth is working together so our communities are the healthiest in the nation. And so my role at MaineHealth is really to foster the culture of innovation and to be the connective tissue between research, education, and care. So as you may know, MaineHealth is the largest academic healthcare system in Maine. It's 10 hospital systems. We have a research institute, we have education division, we have Nordics, a diagnostic lab. So it's really about being that connective tissue to move innovation forward, to identify ideas that are novel, that solve an unmet care need. And so how innovation fits in is, we believe, by thinking differently and by challenging the status quo, that we'll be able to really transform care. And so what we're doing is really leveraging the insights of our 22,000 care team members, right, who are the experts in care and who see the challenges and opportunities worth solving. So we have an incredible potential to impact healthcare through innovation. And so what we've been doing over the last 18 months, our services around education, connections, and funding. It's about how to teach people to think differently. It's connecting because it takes a global village. So it's great to be here and expand our network. And we've created an innovation fund as well. And so with all of this activity and support and infrastructure that we're doing, we've also focused on our intellectual property policy. We've expanded it across the system, and we're also expanding the patent portfolio. So as you can imagine, being in a healthcare system, the innovators are pediatricians, they're ER docs, they're social workers, there are finance colleagues, they're everyone that we welcome to move their idea forward. So our patent portfolio is really expanding. It's in the last 18 months, we've expanded it by 80%. And it's everything from an app to clothing, to therapy, to products. So it's really quite exciting times here. So, and I'll just leave it at that and let my colleagues move forward. Thank you.
Sure. Well, perhaps I'll jump in. My name is Renee Kelly. I'm with the University of Maine, based in Orono. We are a statewide institution with the land grant mission. We have a long history since 1865 of working directly with the private sector to solve Maine's problems and challenges in advanced industries. So this type of work is to some degree part of our DNA, but we are always working to embrace a culture that supports innovation and entrepreneurial thinking. And so part of my role is to build the systems and programs to help facilitate that work with impact across Maine and beyond. We have a number of different programs. And Greg, I wonder, do we want to just do introductions and then show slides later, or would you like me to?
No, go ahead and show your slide. That's fine. I think that'll help us. It's such a sprawling institution. I think it will help give us a little bit of roadmap for what you're talking about.
I'll do that. Let's see.
Great.
So one of the things that we have built, particularly as the state really began investing in research and development within the University of Maine system, is a capacity to serve Maine companies. We have multiple research centers on campus that open up their doors to work with companies. And so part of what we like to say is that UMaine is the R&D lab for all Maine companies. So many companies can't afford their own research and development facilities. We can help fill that gap for them. And you can see from some of our numbers from last year that resulted in 319 projects with industry that year. We do have a very large research enterprise. The University of Maine in Orono does about 86% of all the research that happens in academic institutions in Maine. And last year, that totaled about $179 million. And we really do have a focus on impact in Maine. So both the types of research that we're doing, because we're situated in Maine and we're a land grant, sea grant institution, they're directly applicable to Maine. But also as we're doing this commercialization and technology transfer work, we are trying in any case to create that impact, economic development impact in Maine. And as you can see here, our revenue from commercialization, meaning license royalties, et cetera, was around 500,000 last year. So I mentioned that part of my role is to help build a system to support commercialization and technology transfer at the University of Maine, and we really support the whole system. And about 4 years ago, we did sort of a self-study of our commercialization assets and work, and found that we did some things really, really well. For instance, the easy access we provide to working with the private sector to develop new innovations. And then we determined that things that we needed to continue to work on included building the culture on campus to really develop this entrepreneurial mindset and give people the skill set that they need, and additional incentives and resources and support for researchers who are interested in commercializing their innovations. So if you sort of think of this as a somewhat linear process, of course, we have R&D happening throughout the university. And I would also just mention that we take a very broad view of commercialization and the kinds of things that can be innovated in. So Susan mentioned, everything from clothing to apps. We, for instance, have a group of educators who've developed a new way to a sculpture as a way to teach mathematics. So it's not all biomedical devices or composite materials. We have a broad range of innovations coming out of the university. So some of the things we've instituted in the last few years to help build that culture include training on what commercialization is and how to do it. And that's now not only available throughout the University of Maine system, but we've opened that up to the public. We have some events coming up in the next few weeks if folks are interested in that, and then events to bring people together. Once people sort of step up and say, I have an idea, maybe they've filed an invention disclosure, or maybe we've just had a conversation with them in their lab, we really built a system around helping them discover what the real opportunity is. We were designated as a National Science Foundation I-Core site, and I'll talk a little bit more about that. And then we've developed a practice for reviewing IP to see if it's something that is actually protectable. As teams have gone through this process, they've identified a potential opportunity, then they can potentially go into a program called MRTA, which we first initiated in 2018. And one of the teams that you'll hear about during the BioStart program actually got its start in this program, Neuright. And in this program, we sort of took the accelerator model from the startup world and brought it back into the research continuum before someone's even thought about creating a startup, to work intensively with them for 4 months, do a lot of homework on what's the market opportunity, who are the potential partners, is this a profitable opportunity, and develop a plan for whether to pursue a startup, license directly to another company or organization, or some other form of approach to commercialization. And then we back all of that up with the other assets we have at the university. So the entrepreneurship and commercialization support programs, the talent. We have 11,000 students and lots of faculty, and they all contribute to the success. We marry those folks up with our teams. funding, both internal funding and funding from Maine Technology Institute, National Science Foundation, and other organizations, and then the facilities that I mentioned earlier. I-Core is a program focused on customer discovery. So this is that key part, initial step in determining what the opportunity is. So we send researchers out who probably never actually talked to someone about whether they're solving a real problem for that individual, go out and talk to the potential customers of this innovation and determine what the right product market fit for their idea is. We've had 39 teams in the last 3 years, and they've gone on to raise additional funding. And as I mentioned, several go on to the MRDA program. And again, this is a program that we've opened up beyond the University of Maine system, and we've had teams from GMRI and MaineHealth also participate in I-Core. And then from our accelerator program, just some quick results. We've had 17 teams go through the first four cohorts. The last cohort just graduated about 2 months ago. So really from the first 13 teams, we've had 4 go on to the national I-Core program, which is like the program that I just described, but on steroids. The teams have to go out and talk to 100 potential customers or partners. We've had 7 startups form, 7 patents filed or issued just from those 17 teams. And they've been able to raise an additional, it's actually now around $2.5 million as a result of their participation in the program. So we're really excited about the way things are coming together in the system and the results that it has been delivering for us.
Great, thank you, Renee. Judy?
Hey, I'm going to share my screen here too. Can you see it?
Half of it.
Half of it, okay.
Maybe if you go into presentation mode, Judy.
Let's see. I somehow lost the taskbar here. Let me try this again. How about now?
Good, and if you could just maximize that slide up front.
Okay. Can you see just the slide and not my screen?
No, we can see your screen, see the whole screen. So if you want to,
Yeah.
in the upper right-hand corner, if you can hit that little thing right there. Yeah, right, almost. Just a little to the left.
Okay, I'm going to do this without the slides to so I'm not holding this up. Okay. I don't think they're critical. Okay, so the way I think of my role at MDI Biological Laboratory, which I'm going to refer to as MDIBL, is that I challenge inertia, because what I want to see is every morning for people to get up and say, what am I going to do today? Am I going to do what I did yesterday? And if so, do I need to do it, or should I be doing something new? And if I need to repeat what I did yesterday, is there a better way to do it? So when I was asked to participate in this panel, it was pointed out that I would be a very large contrast to the other institutions, because we are microscopic in size. We're fundamentally a research institution, and we have a staff of just under 70 people right now. So part of what we're doing is inventing the airplane as we're flying it. Our primary activity is research, generating knowledge and disseminating it. And I like to look at this as one end of the knowledge spectrum. At the opposite end of basic research, you have commercialization activities like licensing agreements and spin-off companies. And in between, you've got the training and mentoring of students, collaborations, and contract research. And I see the participants as being able to move back and forth on this, though there are some who see their positions as fixed. And my role here, as was mentioned earlier, culture is so important, is to create a culture here of innovation and entrepreneurship. So let me just give you a quick overview of what our lab does. The research training is part of it. The basic research training collaborations that include our visiting scientist program, which goes back over 100 years, partnerships with other institutions and programs, and then that basic or the translating of knowledge, which is both internal and external. We have very little experience. We have one spin-off company to date. We have another one that we're thinking about spinning off. And but we also have a life sciences incubator, and to date have had about 7 startup companies in the life sciences go through this. So we see ourselves as not just trying to create these opportunities for ourselves, but also for Maine's economy. And I want to just give you a quick overview of each of these areas. Our research, you may know, is focused on regeneration and aging. Our focus on molecular mechanisms underlying regeneration, tissue repair, age-related degeneration, and diseases. And if we can identify those switches that can be turned on or off, in translational terms, this research has the potential to discover drugs that could activate regeneration or slow the aging process. And to do this, we use a variety of animal models, which is fairly unusual to not focus on just one. One of which is the axolotl, which is a Mexican salamander that has amazing regeneration capabilities, as well as zebrafish. And we also use C. elegans, which is an almost microscopic roundworm that has a very short life and is very useful in studying aging. And we've just recently introduced a new model, which is fairly new and not many people using it, called African turquoise killifish. And they have regeneration capability. They're vertebrates, so they're closer to us. And they also have very short lives, so we can use them to study where does regeneration end and aging begin, or is it the same process? It's just semantics at this point, but that has a lot of potential for us. I want to just talk briefly too about the research training. We have over 30 courses and conferences a year that probably serve about 700 participants, including medical students, early career physicians, science professionals, undergraduates, graduate students, postdocs, and we even have a biomedical boot camp for high school students in the summer. One of the categories of our courses are for biomedical innovation, and one example of that is a course which unfortunately we haven't been able to hold the past 2 years. The last time we did it physically was 2 years ago, but it's applications of organoid technology. And you may know organoids are tiny 3D cultures that replicate a lot of the complexity of the whole organ. And they have the potential to impact the field of drug discovery and open new approaches to personalized medicine as well. I want to take a moment and just describe for you the Maine MCE, which is an NIH-funded program. The full name is Institutional Development Award Network of Biomedical Research Excellence. And this is a specific NIH program that is designed to make states more competitive. There are 23 states plus Puerto Rico that are eligible for this funding. And MDIBL has been the lead institution on this since its inception in Maine in 2001. And what this program does is it funds young faculty at member institutions. It funds infrastructure, state-of-the-art infrastructure that the member institutions can share. And it also provides for research training for undergraduates, summer internships for all the members, and we do academic year short courses here at MDIBL for the member institutions. And there are 14 of them that include most of the University of Maine campuses, Bates, Bowdoin, Colby, College of the Atlantic, University of New England, and Southern Maine Community College. So that I may be referring to that later, but I wanted to put that out there so you're aware of that program, which doesn't really get enough publicity, I think. But we're also using these programs to add innovation and bioentrepreneurship. We've done bioentrepreneurship with our summer students 2 years ago when we had to go to virtual service. We introduced an innovation week and a translational medicine week. And we plan to add an introduction to IP and innovation to all of our Embry short courses. Our partnerships and collaborations are important. We do a lot with the University of Maine and others. We are expanding and hopefully, planning to bring in students from some international universities. And that's part of our overall plan to try to increase our critical mass here. We plan to bring in probably close to another 30 postdocs, graduate students, and visiting scientists in the future. And just the last item I want to mention is the innovation and commercialization, which I've pretty much touched on. And that's both internal work we do internally. We filed, as I said, this is very new. Just 2 months ago, we filed 2 patents. So they haven't been published yet. There's not a lot to say about that at this point in time. And also the life sciences incubator that we can invite people to inquire about. Thank you.
Great, thanks, Judy. You've heard from 3 very different institutions. You've heard about the culture of encouraging innovation and encouraging people to at least be thinking about commercialization. Susan, let me start with you. Can you please highlight one thing that your institution is doing today that it wasn't doing 5 years ago and that you think is going to have an impact on the ability to sort of reach a commercialization mindset?
Just the fact that MaineHealth invested in an innovation division like 18 months ago. They scanned the nation, looked at the innovation healthcare systems and said, yes, let's do it. It's in our history. It's one of our core values. So let's put an investment into that, create a division, create a team to move that forward. And I think that in itself is incredible. And so moving that forward with the programming, with the investment fund, with collaborations that we're creating across the system, I think that's how we'll move commercialization forward here. And just within the last, 18 months, I'll give you an example. So like we have Sarah Cox, who's a nurse, and she wanted to think differently. She works with, she's redesigning the hospital gown, and she works with brain injured patients. And they have a tendency to pull out their tubes because they can reach through their Johnny. She said, let's think differently about this. So she's creating a new Johnny jumper, and it has a back and it has snaps on the side and along the shoulder. So the patient, she's testing this out. She created one. We connected her then with a Maine company called Common Threads to help remove her prototype forward to get further feedback and to iterate quickly. And she filed for intellectual property with Todd Keeler, who is an expert in IP and tech transfer here at MaineHealth. And then we helped fund her garment, but she was also able to test it within the ecosystem here, right? Does it work? Get feedback and iterate again. And then our linen colleagues jumped in and introduced us to one of their contacts, which is Standard Textiles, which is a US corporation who has an innovation arm. And they're looking at her, this Johnny jumper to see if they can design, manufacture, bring it back out into the world, but back into MaineHealth, right? And to Maine. And so that's just one example of how, with an investment from MaineHealth into the innovation division to help commercialize a Johnny jumper that meets it's a novel idea that meets an unmet care need here in Maine. So that's just one example of how we
Right.
see it moving forward.
Thank you, Susan. Renee, you sketched out a very clear sort of commercialization path in your earlier presentation. Talk to us about access to funding. You know, what are some of the ways that your initiative here gives people access either to internal funding or external funding?
Sure. Well, and it's graduated. So we start with very and encourage spending small amounts of money and progressing through to larger amounts of money as they get closer to commercialization, because these teams that very often have large amounts of research funding, but funding for commercialization specific activities, they're not accustomed to going after. So through our I-Corps program, for instance, they can get $3,000. So not a lot of money, but we're really focusing them on getting out of the building, so to speak, and talking to the potential customers. And you don't necessarily need a lot of money for that. But that helps inform their research as they continue down that road and makes them much more efficient and effective with their research. Teams that participate in the MRTA accelerator program get up to $35,000 to pull together a team, actually, because we do require this really intensive interaction for 4 months. We either buy a faculty member out for a course or pay a stipend for a graduate student or an undergraduate student so they can really spend some concentrated time on it. But that funding also includes things for prototyping or IP filings or market research, those sorts of things. So that really helps them make a lot of progress in a short period of time. And then we encourage them to go after National Science Foundation funding, whether it's the next I-Corps level or Partners for Innovation grants, or almost all of them seek MTI funding. And because they've gone through I-Corps and MRTA, they are really well positioned to be successful in getting MTI funding because they've done their homework.
Yeah, MTI has been a really valuable organization in Maine. Judy, so in your small institution, tell us how at what point do you help people evaluate commercial potential, and at what point do you say, yeah, we're going to give you access to patent lawyers, for example, to help evaluate whether your idea is protectable and whether it's truly novel from a legal standpoint?
I would say we are new enough at this and have done so little of it that we're figuring it out as we go. We're obviously in constant communication, or I'm in constant communication to understand the research that's going on here and to make suggestions. And then as I mentioned in the case, we had two instances where it was felt in general that we have potential to file for a patent. And the IBL has committed to cover the patent costs as far as the US patent goes, and then see where it goes beyond that, because of course foreign filings are so expensive.
Right.
But we're way before we need to make decisions about avenues for commercialization. I know, for example, if we get to a point where we think a separate company is valid, we would certainly go to MTI. We would certainly avail ourselves of the University of Maine programs that Renee has described, and probably go the SBIR route.
Susan, thank you. Susan, tell us about you had mentioned to me, and you mentioned briefly in your remarks this morning, the fund that MaineHealth has put together. Tell us a little more about that, and who qualifies and who decides, those sorts of things.
Sure. As we create this, and foster this culture of innovation, ideas need seed funding. And so one of the many things we did was create this innovation fund. And the first one is the Ignite Fund. It's up to $20,000. it's available to all of the competition is available to all of our 22,000 care team members. And so the idea is to, for a year, they come up with an idea, they have a team. It's not a grant. The idea is for the innovator to move their idea stronger ahead, to be stronger, to apply for additional funding. So MTI again has been incredible as far as almost matching the grant to move the innovation forward. And so we've had 11 projects that we've invested in so far, and we've had a return on investment of like $58,000 with the help of MTI in matching the fund. So that's been terrific. And it's all about addressing an unmet care need. It's a novel product, process, or new care team model. Ideally, we're looking at the scalability across the system as well as a larger impact. And so that's been really exciting. And then this summer, we launched another fund called the Bonfire Fund for 100K. Again, it's to help on the, what are the ideas out there that needs that investment. And so it's more on the commercialization component, trying to help spin out companies. And we have a review committee of at least 20 people involved in the process. We have criteria that needs to be fit. So it's a very transparent process and formalized infrastructure to move it forward. And so to me, it's incredibly exciting, right, to see what's coming through the pipeline and how we can help. And with the intelligence around the ecosystem, it's fantastic to see the medical device expertise, the therapeutics, the diagnostic, the products that can help move innovation forward, because we're the experts in care, right? Our care team members are the experts in care. So we need that other expertise that's been incredibly helpful.
Does, in the Bonfire Fund, does MaineHealth, what does MaineHealth get? Do they get an equity interest? Do they get promises of repayment? What's the deal?
There will be, there is an equity component in it. And the way it works is it's like an investment into a company. And so we will get equity in it, on the intellectual property side, MaineHealth, we looked around the country. We compared it to Penn, partners, things like that. And we've developed an incredibly generous IP policy where the inventor will get 40%. Their department will get 20% of the return. And then MaineHealth will get the additional 40% that ideally would go back into research or innovation. So we're trying to become self-sustaining. It might take 10 years, but that's okay. And it's more about advancing innovation, offering something that's different than a grant, and collaborating with the ecosystem.
Right. So Renee, I want to turn to you. So you've described the most mature of the commercialization paths this morning of the three institutions. So is technology transfer at UMaine, is it expected to pay its own way? What's the goal here? And do you have either sort of mandatory, a narrow set of terms, or a menu of terms, or is it pretty much you look at each individual project on its own and figure out what makes sense?
Yeah.
So a lot of questions.
Yeah. So I'll try to go through those individually. Certainly we would hope to have commercialization, tech transfer pay its own way, but that's generally not the case at most universities, in part because the more you do this, the more it sort of creates a snowball effect of more people getting interested, which then generates more expense. So it's not necessarily about trying to recover our costs, but making sure that the research that we're doing has impact broadly. It's being translated to the real world, but even more importantly, as a public university, having an impact in Maine. That's part of our mission. And so that was question one. Question two, remind me, Greg, if you can.
It's the same question I asked Susan.
Yeah.
What's the deal?
Oh yeah. And just going back to the before I go to that, the funding that we provide for the teams in MRTA in particular, like Susan was saying, this is not a grant. We don't sort of write a blank check to the research teams and say you have $35,000 to spend while you're in the MRTA program. We collaborate with them to identify, we have the mantra fail fast, fail cheap. So what are the things you need to spend money on in order to get smarter about what's the commercialization opportunity for this idea? So it's milestone based. If they don't use the 35,000, we roll it in to support another team in the future. And then in terms of what are the terms, we do have sort of transparent standard license agreements, but again, we want to help support the team being successful in their commercialization efforts. So we're then flexible. We'll look for the best kind of licensing structure that works, which will be very different from a startup initiated by a faculty member and a grad student than it would be a license to a global corporation. And then also depending on the type of technology we have, again, I mentioned we have a wide variety of technologies. The license for a startup that's doing educational materials might look very different from a license for shipping containers. So we try to be open to what's going to be most successful to make this whole commercialization effort maximize the benefit.
Can you describe for us a couple of recent examples of startup companies that started under your wing and now are leaving the nest?
Yeah. So you'll hear from Neuright later, so I won't steal their thunder, but that's one of them. One that's sort of a little bit further along the commercialization pathway is advanced infrastructure technologies, or AIT bridges, which so many of you have probably heard Habib Dagher talk about the bridge in a backpack technology, where these are rapidly deployable bridges. We created a spin-off company to commercialize that. That company is located, its headquarters in Brewer, Maine. It's building bridges all over the country and beyond. Actually, it's done some outside of the US as well. And they're now at the point where they're acquiring other companies. And then another more recent example is, I'll pick, there's a bunch of them, Unar Labs, which is based in Portland now. It was founded by a faculty member in our School of Computing and Information Sciences and one of his graduate students. And they are developing software that helps visually impaired people use visual and other educational materials. So for instance, text is easily sort of readable for someone who is unable to see that text, but if it's a graph or other types of visual information, it's much more challenging to make that accessible to visually impaired people. So they're developing software to address that challenge, and they've gotten about $1.5 million in SBIR funding to advance that project, and they're beta testing this fall.
Great. So I'm going to continue picking on you because I know you have to leave, and so let me ask, how do you? So you've outlined this process. How do you benchmark your program against other proven winners in the technology transfer business? And how might this the entrepreneurship community in Maine help you succeed in cultivating spin-offs or third-party licensing deals?
So we are looking at things like the number of people, sort of the input side of things, the number of people engaged in the whole process. So that means training for students so that whether they continue on this commercialization project or not, and when they go out in the world, they have a set of skills that will be really valuable in the private sector or in academia. So we look at some of those input sides of things, but I mean, I put up the graphic on MRDA at the end. We're looking at the amount of funding that these teams then are able to attract, whether that's grant funding or private equity investment. We are looking at how many jobs they create ultimately, and where those jobs are. Their longevity, sort of survival rate, if you will, and just the number of startups and licensing agreements that we are able to form through the process.
And one last question for you. So part of this commercialization path very often involves sort of a patent assessment. Do you work with the University of Maine School of Law at all and on the IP side of it?
We have had some interns in the past work with us, and it's a conversation we've been having with the new dean of the law school, Lay Softly, about how do we foster more of those kinds of opportunities in the future. So more to come on that, but we're excited about the opportunities to do more of that.
Great. Great. Judy, let me turn to you. So as this initiative continues to evolve, are you seeing an effect on the culture at the lab? Is this something that might be its own best reward?
Yes, but I'm not satisfied with where we are right now. And in all honesty, I feel like COVID has been a barrier to this. We've been able to work throughout the pandemic and be very careful about this, but we're all pretty much, even here on campus in these days, isolated, and people are not really comfortable congregating. Just prior to the pandemic, we had initiated what was to be like a monthly meeting for people to come together internally and just be open, sharing ideas over coffee kind of thing. And I really look forward to reinstating that, and also involving more than just our faculty, but many of our research associates as well. But we've talked about this and feel like it's more important to wait and do that when we can do it in person than to try to do something like that on Zoom. Zoom has been a great tool and taught us that we can do a lot more than we thought we could, but it's slowed that down. But it has given us other opportunities. For example, some of our courses we had to cancel, but others we were able to do virtually. And even in 2020, we were able to have summer interns who were more focused on bioinformatics work remotely. And we're able to, Renee has helped participate in some of these panels we've had with students too on innovation. And my own goal, and I keep saying this so nobody here is surprised, but I would like to see this element of innovation worked into everything we do. That there's a little piece of it, everything we offer, just giving somebody the idea. I didn't experience this summer with students where I gave an introduction to IP and then learned later that they came to it with such diverse backgrounds. For some of them, even the terms I thought that I was using that were simple terms were terms that they weren't familiar with, whereas others, just ran with it. And I really feel because disseminating research involves building the next generation of scientists, and that's so important, that this whole idea of building the culture really needs to start, pre-K. And, I'm not going to go into that part right now, but it's something that we're just going to keep pushing on. I'm watching closely what Susan is doing. I love the innovation cohort, and we'd love to try to figure out how to adopt that. I'm looking at ways that we can get together funding for an innovation fund because, you know, a researcher's time is so tied to the funding that allows him or her to do things, that I want to be able to provide those opportunities.
Yeah, and I would just encourage you, you know, there is a big world in Maine of people who touch on this, you know, MCE, BioME, we've mentioned MTI. I'm on the board of Maine Venture Fund, which you know, is very interested in this area. We don't fund way down, you know, way down the evolutionary path. You know, normally you have to have a pretty good product, demonstrable, but we're always talking to companies at very early stages. You know, there's dozens and hundreds of consultants and, you know, very smart people running around in Maine who are really interested in this. And I would just encourage you to be thinking about how the outside community can help you, you know, succeed in your very worthy mission here, Judy.
I totally agree with that. And I spend a lot of time and effort in trying to understand the landscape and getting to know all these players. So if you have a list you want to send me, that would be great too. Thank you.
Yeah, I should have mentioned Maine Angels and Bangor Angels. Again, these are people who typically don't, you know, they don't invest at the test tube stage, but they're a little farther down the path, but they're very interested in the test tube stage. And I imagine, you know, the work that you're doing is in such an exciting area. You know, a lot of it, I'm sure, is, you know, confidential and trade secret and all that stuff, but it would be sort of mind-blowing for the commercial and the investor community to actually one day, you know, come to your charming facility and hear about some of the stuff you're doing. It's really, it's amazing, and it would be inspiring, you know, to a lot of us. So so keep up the good work. Susan, let me turn to you. So let's talk about this a bit. You know, how you mentioned that you went around the country. You know, I mean, you personally have experience with this, okay? You know, in Massachusetts, but the organization, you went around the country and you looked at sort of tech transfer initiatives, innovation initiatives at other, you know, prestigious, you know, institutions. So in that sense, you know, you're already benchmarking yourself against the best. What can the rest of us outside of UMaine do to help you succeed? How do you see the relationships with those in the, I'll call it the larger world, coming inside and helping you, you know, achieve the very lofty goals that you're setting out to achieve?
How can the global world or Maine?
Well, let's start in Maine. Okay. So
it's happening. I mean, this is it, right? And this opportunity in building relationships and understanding what everyone is doing and how can we best collide and amplify everyone's expertise. I mean, it's amazing. And that's what's so exciting about it, because, you know, our vision is making the communities in Maine the healthiest in the nation, not a sector, it's all of Maine. And just having the expertise in business, in finance, and marketing, and all of that helps complement what we're building together, right? Is this biomedical ecosystem, the startup community, new therapeutics, diagnostics, products, entrepreneurship. And that's why this is great. And so we are doing it.
So Tom and Agnitsa, what are your reactions to all this? Why did you ask for this conference to start off with a technology transfer program to begin with? And what do you see the greater entrepreneurial community in Maine? What's at stake here?
Yeah, I can just start by saying, you know, this is where it all begins. And there are other initiatives around the state that are focused on attracting companies from other places to come to Maine, but we really believe as part of this initiative that we're undertaking that there are a lot of great opportunities right here in Maine that need to be, further nurtured and fostered. So just as one example, I was up in, beautiful East Boothbay last week, touring the Bigelow Center for Ocean Sciences with Dr. Deborah Bronk, who's the president there. And, I was like a kid in the candy store there. It was just amazing, all of the things that are happening there. They've got 3,000 different strains of algae that they're researching. And they have this sort of national bank of algae. And they have all of these great commercialization opportunities that they're looking at right now about how to use algae in different ways. They've set up this National Center for Marine Algae and Microbiota, which is literally a national center focused on how to use algae and to introduce it to new products and services. And so they're really excited about tech transfer right now. They've got some great opportunities that are percolating there. So from my perspective, it's, how do we look at the Down East Institute, University of New England, obviously all the folks that we've just heard from, and get more of the conversation out there and try to surround these different opportunities with the resources that are already here. So we have 220 mentors in our mentor network with expertise in many, many different areas that we can draw in and surround these researchers and grad students and folks that are interested in commercialization with resources that, folks that are willing to roll up their sleeves and volunteer their time and put some effort in. And I just put in the chat a little while ago that Todd Keeler, who was mentioned earlier, who's one of our MCE board members and an old friend of mine from the tech transfer office back at the University of Vermont, and an expert in tech transfer who's working for Maine. He's been engaged in this BioInnovate program that we launched as part of the EDA grant. And the whole focus there is really getting out to these various research performing institutions and, just making sure that they all know that, first of all, that it's okay to try to commercialize technology, that we're trying to change the culture in Maine so that, more of the sponsored research that comes to the state ends up being products and services. So, it's all of those things. And, we're really fortunate to have so many great assets here in Maine already.
Yep. Agnieszka, how about BioME?
Yeah, sure. Thank you. And thanks, Tom. I second everything that Tom said. I think that's where everything starts. And thank you to all the panelists, and also to Todd Keeler, who I know is on this meeting because he's like a pioneer of tech transfer in Maine. I'm so glad that we have Susan in Maine because that's a fairly new position for MaineHealth. And we definitely loved the idea of that whole position and, innovation and focus on innovation at MaineHealth because there's a lot that can be potentially commercialized there. Judy, if anybody ever had a chance to go to MDABL and see the amazing research that's being done there, the research institutes in Maine are just mind-blowing if you go to any of them. And so it's important to foster that and to nurture that and to make sure that, some of these ideas can be commercialized. So I appreciate all of the efforts and I'm looking forward to having more of them. And I'm so glad that we have this conversation here because I think collaboration is key to that as well.
Just have one more point to add to that, Greg. So, one organization that hasn't been mentioned here yet is the Rue Institute, which is another powerhouse opportunity for the state of Maine, working with Northeastern University. Actually as of today, we're submitting a grant proposal with them. Actually, they're submitting the grant proposal with us as one of the components for the Build Back Better grant. And when I went over and spent time, just walking through all the different assets that they have available, not just in Maine, but, through Northeastern University and all of the different research components that they're bringing to Maine, it's really a fantastic opportunity for us. So what we're proposing to do is, in addition to the BioInnovate program, which is focused on tech transfer, and the BioStartup program that you're going to hear about in the next session, we're proposing to do something that's more focused on later stage life science companies and building an accelerator program to help those companies get to the next level and to really scale up in Maine. So that would be part of this whole continuum of care that we're trying to build here, really at every level, from someone with a good idea all the way through to, getting companies scaled up here so we have, more success on that front.
Yeah, and Techstars would be another institution that's sort of newly landed in Maine. You mentioned the government money, Build Back Better, I was in a recent Maine Venture Fund meeting. I was really interested to hear about the virtual flood of money that's coming into Maine. And the challenge always used to be, where are we going to find the dollars? And now the challenge, at least for a moment in time, is going to be, how do we spend the dollars? How do we do this? How do we do this the right way? How do we support, research institutions in Maine? How do we support attracting talented people into Maine? Susan, your initiative, I'm sure, is making MaineHealth, giving you a leg up in recruiting talented people from across, the country, who now know that they can live anywhere. I've been working out of my house now for, a year and a half, and I really like it, and it's proven to me that I'm not tied to any geographic location. I literally could live anywhere. I choose to live in Maine for all the obvious reasons. The 56 people who are on this call all understand why we all live in Maine. But Susan, does this help with, does this create a virtuous cycle of attracting, new talent to Maine and just further amping the engine?
Yeah, absolutely, because it's a unique value proposition, right? So it helps with recruitment, it helps with burnout that you hear about, it helps with engagement. And so, it's really fun after presenting and sharing what we're all building together. The reaction is in that culture part is, this is so hopeful. This is so exciting. Like, we can do something. I can do something in addition to, it's moving my idea forward, and it's really exciting times and a great culture. So yes, it's great for recruitment, engagement, prevents burnout. So.
Yep, I totally agree. And of course, an institution in Maine that's been mentioned a couple of times this morning, but is unbelievably successful at taking basic research and turning it into commercial products is, of course, Jackson Labs. And so we'll be hearing from them later on in this program. But so we're just a few minutes shy of our scheduled ending time. I don't know if anybody's been monitoring for questions, but if there are questions from the audience, or if people want to stick their hand up and make a comment about this, you've got 2 minutes. Judy, let me just say that that we didn't see your slides, but the one slide we did see proves that of all the people here, you're perhaps in the most charming location of all of us, and so you're very fortunate in that.
I'm sure there are others in Maine who would contest that, but I'm not thinking about it.
Yeah.
This is
well,
not this.
And we wish you well. I mean, in your path toward finding, toward taking these incredible researchers and kind of orienting them, or at least some of them, in a different direction. And I love your opening comment about, waking up every morning, thinking about how you can set people in sort of the right direction. And that would be good guidance for all of us. We should all wake up in the morning and think the way you think, Judy.
Greg, we do have a question. Justine was wondering, where will we be in 5 years? Does anyone want to share a vision?
So let me, as a preface to that question, think about where we've come in 5 years. Think about where we were 5 years ago. Susan didn't exist, at least not in Maine. And a whole innovation center, Judy's initiative, did not exist. UMaine did. Tom existed.
No, I came here 5 years ago. So.
Oh, 5 years. Oh, okay. So, so Susan, you want to talk about where you'd like things to be in 5 years?
I see us humming, right?
Here?
Yeah, I see us all humming. The Maine is just this ecosystem of innovation in with our culture, with our spin, supporting a number of spin outs. The research is amazing. Some of the therapeutics and diagnostics are coming out, and that we're one, right? We're doing this together as one, as we put the pieces together. So I think it's incredibly exciting times. And we are leaders, and we will be a leader for the nation.
Judy, you get the closing remark. Where will you be in 5 years?
I am incredibly optimistic for what Maine has right now as opportunities. And I mean, we have all this money coming in, which is true. And I'm involved in a lot of these groups that are scrambling around trying to figure out how best to manage this. But I think what's more important, I think what this pandemic has actually taught us is we don't have excuses anymore. I used to say, I'll meet you, I'll come to your office and we'll visit in 6 weeks, and then there'd be a snowstorm and it would never happen. And now all I have to do is say, tell me when you're free next week and we can get together, and think of all the time I save. It's a 3-hour drive each way to Portland. But I really think what we need to do is work together. I think we have so many assets in Maine. I think we don't even understand what we have. And if we put it all together, 2 + 2 is going to be a whole lot greater than 5. And we also need to understand what those gaps are so we can fill them. So what I'm hopeful for is, as Susan said, just increasing collaboration, because I think we have so much here. We're in the world we live in today, by comparison, this is such a desirable place to be. And I just have to say, I keep going back to the bio report that it gets published every 2 years. So it was the 2020 report that shows that the average wage in Maine overall is something like 40,000. The average wage in life sciences is about double that. And if the state's goals and their economic development strategy is to add 75,000 workers and to increase average wages and value added by 10%, investing in life sciences is the way to do it, because you're going to go a lot further, a lot faster. And I say that every day too, after my first comment about waking up, but I'm in it. I'm in it for the long run.
And if you need some IP lawyers, along the way, I know where I can find a few.
Okay, thank you.
Tom, we'll turn it back to you.
Okay,
Thanks
great.
so much.
Thanks so much, Greg. This has been fantastic. We've got a 10-minute break scheduled. Actually, like to have everyone back at 10:20 for our next session, which will be the BioStartup Showcase. So see you soon.
Thank you.
Thank you. Okay, everyone, it's 10:20, and we're going to get started with the second part of our 2021 Life Sciences Summit. This panel discussion this morning was really awesome. Paul, you have a tough act to follow here. But now I'd like to introduce Paul Fitzpatrick, who will be our moderator for this session, which is focused on the BioStartup program that I mentioned earlier. Paul Fitzpatrick is a contractor to the Maine Center for Entrepreneurs, who has been working with us over the past year to develop this BioStartup program, and has recruited the first 5 companies into the program and has been working very closely with them, along with a whole range of other mentors and supporters. And Paul has an amazing background in life sciences, ranging from working with medical device companies, healthcare, consulting. He's been involved in the hospitality industry, so just a really wide range of business expertise to bring to bear. And we were fortunate to find him in South Thomaston, Maine, and brought him in as the program manager for the BioStartup program. So with that, I will hand it over to you, Paul, for introductions.
Great. Thank you, Tom. Really appreciate it. And you're right, this is a great segue from that initial panel discussion about talking about innovation and what the resources are around the state of Maine for innovation. Our program, the BioStartup program, is really conceived to pick up companies that are at the innovation stage, but have flushed out feasibility versus viability, have some IP that can be adopted around it and help it form a company and translate it into a commercial entity, or pick those companies up when they're at that state. Maybe they have a working prototype. Maybe they've already formed their company. Maybe they're thinking about the stage to commercialize, but we bring resources together to help those companies organize and in a very, very tactical way. And I'll let the participants speak about this during the hour discussion, and help them move their ball forward in a real world way to address issues that are facing them and challenging them. And as Tom has said before, bring the many resources around the state of Maine to bear to help them do that. So without really any further ado, this session is really geared around an opportunity for the 5 companies that participated in the inaugural cohort to really showcase their technology, talk about their technology, talk about their journey, and give a presentation. If there's during the presentations, if you happen to have a question for any one of the entrepreneurs, feel free to put it up in the chat. We'll try to monitor that. We're trying to allow about a 10-minute time at the end of the session to ask the panelists questions directly or open it up to the audience for questions. So without further ado, first up is Jem with Salmonics. Jem, are you ready to go?
Sure, I'll share my screen here.
Okay, great.
Okay, can you all hear me okay?
Yep.
So good morning. People often ask me, how has COVID-19 affected you? And I guess among other things, the biggest impact was in the form of a life-changing opportunity, both on a personal level and a professional level. The opportunity came last fall in the form of a chance to purchase partial assets of a Maine biotechnology research and development company and to establish a new company with those assets. Initially, this seemed like an unlikely event, in large part due to the financing need and also the need to have a steady monthly income. But all of this was set in motion during a weekend hike up Little Jackson Mountain in near Phillips, Maine, with my wife and some friends. During that hike, not only did we come up with the name for the company, which at that time still seemed remote, but our friends the very next day offered to provide half of the financing that was needed for that partial acquisition. In other places, business deals are done on the golf course, but I guess in Maine, we do it in the hiking trail. Thus, that climb launched me into a career and life change, whereby I eventually left a career in aquatic animal health, as well as the main company that I had dedicated 22 years to, in order to start a new biotechnology company, Salmonics. Aquaculture in Maine produces about 18 tons of salmon per year. One of the waste products of this aquaculture activity is blood. Based on the number of salmon that are harvested and the amount of blood that can be obtained per salmon, that's about 200,000 liters of blood waste. The main research and development company, Searon Holdings, has for the last 20 plus years been developing biomedical products from salmon blood and has achieved some commercialization as well. Salmonics was established to take over the trademarks, patents, and other technology from Searon Holdings, continue their work, and also expand the global market for salmon-derived biomedical products. Our goal is to form an interface between biotechnology and aquaculture by utilizing blood, which would otherwise join the waste stream. What we want to do is create high-value biomedical products for the global veterinary and human health market, and at the same time provide a value-added return to aquaculture companies. Our products are used in immunology, cell and tissue culture, wound care, pain treatment, regenerative medicine, and stem cell research. Global markets for these products are collectively around $2.5 billion annually. So we hope to capture at least some part of that market. Our laboratories and offices are set up in Tech Place, Brunswick Landing's business accelerator. For part of our operations, we renovated the room that the US Navy used to repair and paint airplane parts. We're also renting clean room facilities in Tech Place. And following the purchase of the remaining assets of Ceron Holdings just this past summer, we also have a satellite laboratory in Eastport, Maine. Our company financials are on good footing. Our projections are healthy. We have currently 5 employees, and we plan to add positions starting in early next year. Our initial focus will be on the global research sector, but once company production and marketing reaches our target levels, we're going to start venturing into the veterinary and human health market in terms of commercial applications. Salmonics is going to need financial assistance, of course, for this growth in 2 phases. One is going to be in 1 to 2 years, mainly to scale up manufacturing and marketing activities. The second phase will be in 3 to 5 years, depending on our growth, to basically start venturing into the veterinary and human health market. The establishment of Salmonics felt like a very extraordinary event, and which moved much more smoothly than I would have expected. And I think a lot of that in large part is because we're in Maine. Establishing a company can be a daunting experience. As scary as it was, most of the time to take this risk. So many doors opened, so many green lights came on, and so many people were there to provide generous help that it felt like the right thing to do. When the person that was selling you their beloved company says, my mission is to help you succeed, there's really nothing to fear. This would not have happened without the support provided by many individuals. My wife's blessing, Ceron Holdings' belief in me that I could do this, my friends' trust and lending a helping hand, the extreme good fortune of finding vested staff who kind of helped me carry this along, and obtaining funding from a variety of sources, including the town of Richmond, Camden National Bank, Maine Technology Institute, Midcoast Rural Redevelopment Authority, and pending funding from CEI were all essential. Guidance from Maine Technology Institute, and one-on-one mentorship through the Maine Center for Entrepreneurs BioStart program, as well as through the Small Business Development Center. They both provided access to type quality business expertise, covering a broad spectrum of topics that were essential, and all it's free of charge. Their input was critical in my decision making and really having a solid judgment as I moved through this process. I was amazed by the generosity and sincere interest that everyone provided. Having first arrived in Maine as an international student about 40 years ago, Maine has educated me, helped me grow up, guided me in developing a career, and is now really helping me create a business which hopefully will provide jobs and additional technology for Maine. In that respect, I feel that Salmonics really belongs to everyone who really helped in its creation. Thank you.
Great, thank you, Jim. That's terrific. Jim has come such a long way in the 5-6 months that I've gotten to know him, some of these pictures really reflect transition we've seen in the development of his company, and he's been just an absolute pleasure to work with over the last few months. So thank you, Jem. We'll have some questions for you. I don't see anything up here right at the moment directly for you, but we'll have some questions a little bit later, okay?
Thank you, Paul.
Okay. All right, so next on the hit parade here is Dr. Jason Hine, who is the founder and CEO of HaloMed. So Jason, are you with us?
I am. Can you hear me?
I can. Yeah, great.
Perfect. Just get my things pulled up here. I apologize to the audience. Mine's a little bit more of a traditional pitched conversation, but if you bear with me, I'll get that set up. I'll save you from any ask at the end, though.
No worries, Jason.
All right.
Okay.
All right. So yes, hello, everybody. My name is Jason Hine. I'm an emergency medicine physician and the founder of HaloMed, which is a medical education company. We're really focused on bringing procedural training to the clinician. So the pandemic has really shown medicine to be a huge asset to society, but it has also highlighted some of the dangers in medicine. And a recent study actually estimates that there are hundreds of thousands of wrongful deaths each year related to medical error. But to understand that problem and the problem that my business solves, I want to tell you about a case that I had personally. I was 2 years out from graduating residency, and I was working in a remote access hospital in northern Maine. And I was the only physician on site when a patient came in with severe burns to chest, head, and neck. And in that environment, essentially alone, I had to perform a cricothyrotomy, which is the placement of the breathing tube in the neck of the patient to allow him to breathe and save his life. While the case went fine, I recognized that even in those 2 short years from graduating, I had lost some of my skill in that procedure. My competence had waned some. And there are many life, limb, and vision-saving procedures that we need to be ready to do at a moment's notice, but these procedures are rare with few touch points in clinical practice, which can really set the provider up for procedural skill decay. So I created HaloMed wanting to solve this problem for myself and my profession. So as I mentioned, we're a monthly box subscription company offering education in procedures. We give medical professionals confidence and competence in their procedural skills through innovation and convenient simulation education delivered right to their doorstep. Now, you might recognize that there are already simulation trainers out there that exist, but they're high tech, they're complex, they're expensive, and therefore usually only accessible within the walls of a sim center, which requires the time, scheduling, coordination, money, and frankly, the will of the provider to access them. At best, this happens once a year, once every other year, or more realistically and accurately, never for many of our providers. We pull away all these barriers by completely restructuring the way that procedural training is done. So how does it work? As I mentioned, our monthly boxes deliver right to the customer's door. Inside them, you have everything you need from the simulation model to the medical equipment to perform the procedure. And this pairs seamlessly with our digital curriculum, so a provider can do their roughly 30-minute monthly training wherever they so choose. Now, there's a lot of procedures that are amenable to this type of training. The ones with check marks are ones that have either designed or fully developed simulators for us, and we have plans to expand in the world of skull trephination and umbilical catheterization in the future. As you can see, our customers can open our monthly box, pull up the digital curriculum, and train in the safety, comfort, and convenience of their own home. But they can also easily bring our product to work environment to further enhance their training and add additional fidelity. Now, our product can also be implemented in educating our other care providers to enhance interdisciplinary education, which is a hot topic right now in medical education. Now, our customer is the clinician, which introduces the idea of CME, or continuing medical education. Clinicians are responsible for accruing a certain number of CME credits each year. They're allotted money by their employer to pay for the education to grow and learn as the field of medicine grows through the year. The provider has ownership of what they want and need to learn, and therefore how that money is spent. This money is generally does not roll over. It's sort of use it or lose it money, which also causes a lower buying threshold amongst our clientele. So our business model, as I mentioned, we are focused on a monthly box subscription with 3 important components: the unique simulation boxes, which we've talked about. We also have a large video procedural library that the client can access at any time, as well as point of care resources like this infographic here, which can be used in the clinical environment. Now, currently with 7 procedures and 3 trainings in each, we have a 21-month or module curriculum, but planned access for, but with plans for our customers to maintain access after graduation with a software as service model. Now, we recognize that we are making unique, convenient, transportable, and inexpensive simulators like our chest tube trainer here, and that people are going to be interested in purchasing our products outside of a curriculum, and we have plans for a la carte simulation model purchases as well. As I mentioned, our target market is emergency medicine, and there's a few important numbers to review here. 58,000 is the number of emergency physicians in the United States. It is the 2nd fastest growing medical specialty in America, and a 2019 report estimated that there was about $3 billion spent on CME that year. Now, we've done extensive quantitative and qualitative customer discovery work, and there's a few important numbers to review in this. 83% of the over 100 emergency physicians say that time and access to resources were their major barriers to training. We see that number again, and that 83% also agreed or strongly agreed that they would spend their CME money on procedural training. And this pie chart shows a little validation of our cost infrastructure. When asked how much they'd be willing to pay for procedural training delivered to them per month, 37% say they would spend $75 or more per month. And again, that validates our cost infrastructure and our margins. We also see other markets and areas of expansion. So the paramedic and EMS world is a natural extension for us, as well as internationally. And we have some numbers on our Canadian counterparts to the north. Let's talk briefly about the competition. With $3 billion out there up for grabs, you bet, of course, there's going to be some other education companies like MRAP and Hippo Education. Hippo Education offerings are there for you to review, but I will cut to the chase. There's no one out there offering tactile training the way that we do. So we have a great team here at HaloMed. We have emergency medicine docs, medical education and curriculum design specialists, and we are actively building out our advisory board in the areas of IP law, operations, and finance. And what's our road ahead? So we're currently doing our beta testing with St. Joseph's Hospital out of Bangor, and I've been getting really wonderfully validating results there. This is happening concurrently with our product development with APIS out of USM. We're also working with bulk packaging on our packaging and our logistics for product delivery. We have a goal for a limited market release in the spring of 2022, and we are in conversations with the Maine Manufacturing Association for scaled production. So what are our next steps? I'm happy to say that I'm onboarding or in the process of onboarding a new partner. As I mentioned, we're moving our prototypes toward finished goods with APIS. We have 2 provisional patents that are going to be turning over to non-provisional in the near future, with many more provisional patents that come out of our current work. And as I said, we're going to be working toward a limited market release in the spring of 2022. So I see a clear path ahead and a bright future for HaloMed. I thank you for taking the time to listen to my presentation and open it up to any questions.
Thank you, Jason. That was terrific. That's exciting time you have here doing the beta test at St. Joe. So that's great to hear. Let me see here. I don't see any questions right at the moment. So again, we'll have some questions at the end of the session for you, Jason. Okay. All right. All right. So we have Signal Insight. Ariel, are you with us?
Yes.
There you go. Okay. So you can share your screen and start whenever you're ready.
Well, of course, I've got this on the other monitor. I knew that would bite me.
We can see your presentation.
Okay. Well, it's not very convenient for me, so let's see if I can move that over. Yeah. No, that didn't work very well. There we go. All right, I just want to be facing you. Thanks for your patience. All right, I'm here today to introduce you to Sonotec, the first direct, non-invasive and non-contact technology to detect and discover and identify key diagnostic information invisible to other methods, with many benefits for healthcare. By the way, everything you see here.
Ariel,
Yes?
sorry, can I just interrupt you? We're only seeing about a quarter of
Oh.
your screen. Can you try to
Okay.
put the full screen or presentation mode rather? Let's see if that fixes it.
I'm in presentation mode and it says screen sharing is paused. So I don't know what that's about. Let me try that again. I'm sorry, I'm not having very many savvy opportunities on this Zoom stuff. So. Yeah. All right. Try again.
There you go. Okay, there you go. Excellent.
Okay, thank you. Lots to learn still in this post-COVID world.
No worries.
Yeah. So I'm here today to introduce you to Sonotec, the first direct, non-invasive and non-contact technology to detect, discover, and identify key diagnostic information invisible to other methods, with many benefits for healthcare. By the way, everything you see here is actual validated data. The diagnostic process today is greatly restricted. We don't have access to enough information. As a result, costs are high, utility is limited, and accuracy, well, not so reliable. How would you figure out what's going on with this fellow? Symptoms are notoriously inexact. Objective information is crucial. These methods are often non-specific. We need to answer key diagnostic questions. Imaging can be useful, but you can't get a picture of inflammation, though it's involved in many conditions, tightness, which can be related to early stage disease or pain, let alone what kind of tissue is in trouble. And to know the dysfunction is everything. How many of you have a place in your body that you wish was less tight or working better? How about patients who have been seen everybody and nothing found and yet feel terrible? These are the people I was working with to try to help them get more comfortable, and I made several discoveries. Working closely with my patients, I realized I could feel kind of a buzz or vibration coming off the body where problems were located. I dreamed of creating a scan that would detect and measure this information objectively. After 20 years of engineering and component evolution, here it is, the eye scan, the first product to apply the new diagnostic technology I call Sonotec. And here it is. You're seeing my screen. Our very first prototype was thanks to an MTI development award, which supported its build. You see the meters going up and down by 30 decibels as the scanner passes over an injured thumb. So this is quite a robust signal we were detecting. However, we needed numbers, details, records to make research and clinical use as accurate and practical as possible. Now we have the current system, digital, wireless, determining and applying proprietary algorithms, capturing data and photos, uploading to our cloud, where analysis tools and reporting expand potential for the findings. Again, with support from MTI, we executed this clinical study comparing veterinary assessment of thousands of horse sites with Sonotec blinded data captures from those sites. Sonotec data correlated strongly with the veterinarian diagnosis. And again, we see a large effect confirmed in comparison of abnormal with normal sites. The imaging prototype also substantiates our findings, as the anatomical part in trouble is verified with the spatial results as well as the condition ID through our algorithms. Confirming credibility has been a key focus for our work, and we have built considerable evidence. Using a variety of testing and measurement systems, we've cross-referenced and verified the presence of the body signals in the acoustic bandwidth. Here you see the SonoView industrial acoustic imaging camera that captures noise from leaking pipes, now capturing the Sonotech noise from the patient. We've also used the industrial SenSound system for a spatial capture of our signals. And we did a conclusive study with the University of Maine's partners. The shape of the abnormal anatomy is conclusive. Our algorithms applied to the signals are the secret sauce here, beyond the raw data, revealing the diagnostic details for medical use. Sonotech signals appear to be related to the chaotic molecular behavior that is inherent in abnormal conditions. Normally, our protein complexes, crucial for body functions, have resilient activity, often in an oscillating mode, as you see here. Defensive messaging kicks in for a number of reasons, creating stiffening, producing nonlinear bursting type of activity. Here's a video of cells actually demonstrating this behavior and producing acoustic signals. Laboratory experiments have confirmed that mechanical changes are linked to most diseases and dysfunctions, but there's been no clinical application yet developed for translating this information to medical research and practice. Sonotech is the answer. Let's look at the recent Nobel Prize Award for Physiology, which highlights the significance of our technology for medicine. Dr. Patapushan defined the piezo sensor. So here's a description. Force or input acts on mechanosensitive receptors in the body, which include piezo assemblies that trigger calcium ion channels, producing reactions, or as another term, behavior. The Nobel Prize recognizes that this behavior, which produces our signals, is at the basis of cardiovascular disease, cancer, all sorts of dysfunctions and pain. And now that it's known, this discovery could lead to possible new treatments. Sonotech solves the need to detect and identify this activity. Find the dysfunction, find the behavior. I'm sorry, find the behavior, find the dysfunction, and find new ways to prevent and treat. Our first planned market introduction is the eye scan for the equine market. It's stressful for caretakers to figure out if a horse needs help. For the veterinarian, examining a horse can literally take hours, including making the horse run back and forth, trying to see what's up. You can see how easy it is to detect and identify with our scan. Our telemedicine model, as well as the immediate capability to detect the problem locations, can ease the process for everyone involved. We are ready to progress our marketing and clinical studies and prepare for sales in the next year. We believe that Sonotech will meet the challenges of diagnosis with many advantages. Sonotech's capabilities can be leveraged for many applications in human medicine, a multi-billion-dollar market. Sonotech is valuable for animal care, as you can imagine. Again, multi-billion-dollar market. Our subscription approach lowers barriers to entry while ensuring ongoing revenues. In the regulatory space, it's streamlined since it's not therapeutic and has no safety issues. We've got a great technical team to support further application development. Our database and AI possibilities are also significant for unlocking further insights for medical research and pharmaceutical development. I've been fascinated with this technology for over 25 years, having brought it to a level of reliability and precision that confirms its unique value for diagnosis to make the invisible visible. At my clinic, Access Health Renewal, our successful outcomes are powered by Sonotech, and we do offer a free assessment opportunity to the public. Just give us a call. By the way, my other discoveries include how to help these dysfunctions relieve and recover. When we detect, discover, and identify, we have objective guidance for therapeutic assistance, as well as measurement of success, as you see here. I have succeeded with Sonotech due to my unique blend of working freely outside of academia with living patients, their signals, and my hands on the body, learning about the hidden world, anatomy and physiology. not a way to build a company, but a great way to discover something important to build companies around. We are ready to move on from technical incubation to science and commercialization and economic benefit for Maine. I welcome hearing from anyone interested in learning more about our resources and creating pathways to revolutionizing healthcare, personally or commercially. Thank you.
Thank you, Ariel. That was terrific. Even with the initial glitches there, you did well.
Thank you.
All right, so we're going to move on to our next participant. Jerry, are you with us?
I am.
Okay, so Jerry is with Treadwell and the sit walking system. Jerry Collins.
So good morning, everyone. My name is Jerry Collins, and I am CEO of Treadwell Corporation. My partner, Richard Hand, and I want to advance and improve healthcare, specifically physical therapy. And with our patented system, we call sit walking. Today, I'll describe the system, how it can improve health outcomes, and how $200,000 can help change the world. To start, I'd like to share my own story with sit walking. For years, I had trouble sleeping due to severe nighttime foot cramps. I'd been to see my primary care doctor and tried various remedies like exercise and medicines. Seeing no results, I had accepted poor sleep as just another of the many adventures in getting older. That is, until I met Richard Hand, the physical therapist who designed the device and protocols we use today. I'd met Richard as he was first launching sit walking. At the time, I was in excellent physical condition and a regular runner. I didn't expect to experience much myself, but I wanted a firsthand understanding of the system. What I did not expect was to suddenly be sleeping through the night within a few days of regular sit walking. I was floored, well, metaphorically anyway. What we realized, and what Richard had already observed for years, was that we could gain most of the benefit of exercise without resistance. We had a system that could impart the benefit of walking, one of the most prescribed exercises, to patients who were too weak or ill to start. About a year later, Richard asked me to help negotiate some contracts and then to join the company. Sit walking was enjoying initial success in nursing homes and physical therapies, and physical therapists reported patients liked using the system. So that all sounds great, but the big question is, what is sit walking? Well, simply put, sit walking is an exercise system that benefits anyone capable of flexing either or both feet at the ankle. And the patient beneficiary is supplying 100% of the energy for the activity. The patented sit walking system is comprised of two elements, a near zero resistance device and the protocols for its maximal use. The system protocols have been developed over 15 years of careful physical therapy application and clinical observation to ensure PT departments can achieve better health outcomes in shortened time spans. The device, which we call the Treadler, is based on the treadle of a sewing machine, leveraging a flywheel to harness momentum, which essentially eliminates resistance and enables patients to attain high repetitions without tiring or stressing other body systems. What our system does is provide access to physical therapy for those who are currently too compromised to start physical therapy. I started with my own story about foot cramps, but I also mentioned the diseases and comorbidities Richard has been treating. You might recognize a few of them, but since there are so many, let's start with the three big US culprits: diabetes, heart disease, and just old age. These three alone depict what I call the three U's. They're universal, they're ubiquitous, and they're unpredictable. By unpredictable, I mean they are difficult to treat, tend to be degenerative, and become more costly to treat and manage the more they progress. We know all three diseases improve with regular exercise and increased blood flow. We know they're notoriously difficult to regain strength from. For instance, diabetic patients often suffer skin ulcerations and neuropathy. We also know that increased circulation promotes both healthier skin and helps repair nerves. I want to talk about other conditions walking can treat, but I guess there are also questions about our origin and how we know it works. So let's talk about the very first sit walking patient and cover both. In 2005, Richard evaluated an extremely frail 84-year-old woman for physical therapy. Her physical deterioration had progressed to a point that walking across her living room, no more than 20 feet, left her breathless and in pain. Physical therapy to restore her strength was wholly beyond her physical capacity. Seeking any activity his patient could safely engage in, Richard spotted the treadle of a forgotten old sewing machine. He asked if she could move the treadle, and they found she could with no discomfort. Richard asked her to engage in this exercise for 15 to 20 minutes each day. He had no expectation it would significantly improve her health, but hoped any activity would help. To his surprise, within a week or so, her pain, stamina, and energy all improved. Using only this exercise, she was able to rebound enough to start engaging in strength increasing exercises. And by the 60-day point of her physical therapy plan, she was walking a quarter of a mile during each physical therapy session. Seeing such incredible results, Richard began using this technique with his other patients. He wanted to understand if what he had observed was a fluke or if it had wider applications. He used it with patients with a range of capability, diseases, and comorbid conditions. And they began to see similar results and notice other unexpected benefits. The treadler evolved from that early sewing machine treadle. First, we incorporated a flywheel to eliminate essentially all resistance and add momentum. Near zero resistance and momentum assistance allow patients to attain high repetitions without stress, and high repetitions are needed to achieve increased circulation for extended therapy sessions. Next, we engineered it to a high ergonomic standards. We wanted to avoid potential for repetitive motion injury in the hips, a problem with sewing machine treadle use. Finally, we built it for institutional application so it could be used all day, every day for years on end. Initial research from the late 1990s and early 2000s by researcher Frank Booth, a PhD researcher, indicated millions die prematurely from physical inactivity. The cost of the healthcare system is in the hundreds of millions of dollars every year because inactivity causes or makes worse many diseases and conditions per his research. The addressable market in the US is $300 billion annually, with the top 5 disease categories all directly impacted by sit walking. There are numerous diseases sit walking benefits that impact a range of body systems. We know from 15 years of clinical observation that nearly anyone can benefit from sit walking, with a caveat that the user must have at least one functional foot, ankle, and lower leg combination. We've seen how its use can dramatically improve a patient's outcomes and reduce the time. And by improving patient outcomes, we project an increase in facility bottom lines with sit walking inclusion. How? Well, Medicare began shifting its reimbursement model a little over 10 years ago. This shift increasingly rewards better patient outcomes rather than adhering to the fee-for-service model. Sit walking provides a tool that reliably improves patient health outcomes with minimal barriers. Patients of all capacity can see benefit. And the system is significantly less expensive than many other physical therapies. While sit walking stories speak volumes, we need clinical trial level data to progress. A sit walking clinical trial began in February 2020, but was ended prematurely in mid-March 2020 due to the COVID pandemic. That trial summary report indicated promising initial results, but contained insufficient data to make any statistically significant conclusions. A sit walking in collaboration with the University of Maine Center on Aging, a newly designed second clinical trial is ready. and waiting on funding to be implemented. An NIH STTR grant funded the initial clinical trial, but the government-funded grant process is time-consuming, and we hope to make up lost time to COVID by shifting to an investor-focused model. Our projected timeline suggests commercialization within 2 years from starting the clinical trial. At this time, we're seeking $200,000 to fund the clinical trial to support our next phase of production. If we have time, I'll happily answer any questions. Thank you very much.
Great. Thank you, Jerry. Appreciate that. All right. So we're going to move on to our last participant in the program. And Kristy.
Yes, I'm here.
There you go. Kristy with Neuright, who was mentioned in the initial panel discussion by Renee Kelly.
Oh, sorry, I missed that, Renee. I had a meeting this morning. Paul, you can see my slides, okay?
I can, thanks.
Okay.
Yep.
Great. All right. Well, I'm happy to be here to talk about Neuright Inc. and a medical device that we've developed for peripheral neuropathy, and also the benefits that we've had through the BioStartup program over the past year or so. So the problem we're addressing is peripheral neuropathy. This is when peripheral nerves die back. It can be caused by over 30 different medical conditions. The top ones are diabetes, aging, which is also an idiopathic cause. The mechanism isn't known, chemotherapy, HIV, and numerous others. Just looking at diabetes and prediabetes in the US, over 100 million people are affected, and 60 to 70% of diabetics will eventually develop peripheral neuropathy. Right now, there is no cure for peripheral neuropathy and no reliable diagnostic, especially for the small fiber type of neuropathy that's common with diabetes. So then there can, not be very much mitigation options. The direct cost to patients are about $2,200 a year, to payers about $6,000 a year. There's loss of productivity as well. So in total, if there are 20 million peripheral neuropathy patients, this will be billions in preventable healthcare costs. So what we've developed is a medical device. It's a microneedle array that goes on the skin, and the needles can penetrate down to some subdermal tissue layers. And it provides a more sensitive detection and earlier diagnosis of peripheral neuropathy through measuring nerve electrical activity. So as the disease progresses, so in a healthy tissue, we have nerves innervating the skin and the subdermal layers down to the adipose or fat tissue down here. But as the disease progresses, these nerves die back, and our device is able to measure that reduction in nerve electrical activity. So this MVP product we're calling the DEN for detecting early neuropathy. And this is the diagnostic portion of a bigger theragnostic platform that we're working on. So in total, our solution is a low-cost point-of-care device. It provides early, reliable diagnosis through sensitive measurements of nerve activity. So this is a functional assessment of small nerve fibers, which makes it unique. The system is portable, wireless, quantitative, and minimally invasive. And eventually, when the full theragnostic is built out, we'll have the capability also to deliver treatments and therapies and collect data that could be used for future research. So this slide is a little bit busy. These are the milestones of the company since our original founding in 2018. We're a University of Maine spin out. So we had a lot of support from University of Maine to develop this company and continue with the R&D. This is my co-founder, Magda Blashkevich here, winning the Top Gun statewide prize, the David Shaw Prize in 2019. That money was really key to getting us off the ground. We're currently housed at the Upstart Center for Entrepreneurship in Orono, Maine. And more recently, these are the co-inventors here, adding in Rosemary Smith in the photo. We have a patent that's pending right now. We have an NSF phase 1 STTR that's finishing up. We're about to submit for a phase 2. And we've just benefited greatly from our participation in the BioStartup program over the past year as well. Oh, and I have to say, MTI has also given us 2 grants that have been really critical, especially at this phase of growth right now. So in total, we see our product as having 3 main applications. 1, baseline recordings. So this would be a screening phase. We've used this already in mice and validated in human that we can measure healthy nerve recordings. Diagnosis, we've completed preclinical testing in diabetic neuropathy in mice and shown that we can see changes to nerve activity. Now we're gearing up in early 2022 to start our first in human testing in healthy versus neuropathic patients. And then in the future, once we have more options for the therapy and treatment of neuropathy, this device also can monitor nerve regrowth and recovery. So this is just a little bit of the data. We're scientists, so we strongly believe in showing the data. So these are some action potential, compound action potentials here shown with the arrows recorded across the different microneedles in the device. This is our team. So we're really proud to have a wonderful team of largely University of Maine faculty. So Len Cass is our neurophysiology expert, and we have 3 engineers on our team as well. So we really have a fantastic group working on the R&D. Our current stage right now as we move to first in human testing is we're fundraising and submitting for a phase 2 STTR so that we can do the optimization of the device recordings in human skin. So this is slated to begin in early 2022. And our clinical partners for this stage are Miriam Fremier and Dave Arnold, who are neurologists and nerve recording experts at The Ohio State University. And that's everything. So thank you.
That's terrific, Kristy. And so, Lori, can you bring up our 5 participants in a panel view?
I am doing that now.
That's terrific. And add Val Kratzman to that too.
Okay.
So we have about 10 minutes left in our allotted time. And I thought what we would do is, everybody did a terrific job in your presentations. Really, thank you. But I thought we would get everybody have a little panel discussion about your companies and your journey, and especially being entrepreneurs in Maine. So I've asked Val Kratzman, who many of you know. Val is a new member of the team and is actually a neighbor of mine and has many, many, many years of let me add another many to that, of experience in the life sciences arena, and just his network is beyond belief, and he has helped many of these companies with network and direction and advice. So anyways, I'm going to just take one quick look at the chat to see if there's any questions from the chat, and if not, no, I don't see any. Okay. So, Val, would you like to ask the first question? Do you want me to go?
Why don't you start? Then we go from there.
Okay, that sounds good. So this question is I'm going to throw it out to everybody on the panel here, right? So feel free to chime in. But as a life sciences, and by the way, for the audience, when I talk about life sciences, it's the broad category. You know, we look at medical devices, biotech, drug discovery, obviously diagnostics. You see, we have several diagnostic devices in the arena. So it's a very broad use of the term life sciences. In any event, what challenges have you faced as you've launched your company here in Maine with various resources in Maine, or just getting your company from that ideation phase to, you know, something that's tangible now and moving forward? Who would like to chime in there? Okay, you're going to make me call on somebody? Let me start with Kristy.
Ooh, okay. Well, I mean, usually I'm really championing Maine. So I think I'd start with what are not the challenges. So I think, you know, Maine really has a growing biotech and bioscience industry, the closeness to Boston, the workforce that we have in the state that's trained to work in these areas, and just the state support resources are, and I know that now because I live in a different state, that it's really unique in Maine. But I think the challenge can be if you're based in a more remote area. That can be a little more challenging to get access to resources. But otherwise, and internet isn't always as fast as it should be in remote areas in Maine. But otherwise, I think Maine is the place to be for this industry.
Terrific. Anyone else?
We do have a follow-up for Kristy. What is the estimated timeline for product to market?
Yes. So as you probably know, any medical device that's, a little bit invasive, so ours does pierce the skin, needs to go through rigorous testing for FDA approval. So we're probably about 5 years out on the early end to having initial sales.
And Paul, we do have two questions for Jem. One was earlier, and it was wondering if you are also exploring the food industry, specifically cellular agriculture.
Yeah, I've been thinking about that as well. And that might come in the future. Particularly, one of the projects that we're working on is the use of salmon serum as a substitute to bovine serum or serum that's obtained from other mammalian sources, both in terms of lower risk of carrying pathogens that may affect humans and other mammals, but also as a cleaner resource. It also has a lot of animal welfare related aspects as well, in terms of moving away from bovine serum. So certainly applications in that respect will come into play once we hopefully can adapt salmon serum to use in larger scale cell culture.
And the other question for you, Jem, was how big is your team now and how big do you think it will be in a few years?
Sure. So right now we are 5 people working in Salmonics, and we do expect to start hiring early next year because production is really ramping up now. Most of the time that we've spent in the past 8-10 months has been really setting things up, setting up the lab and facilities and getting all sorts of things in order, as well as, of course, financing in terms of making sure we have a good financial footing going forward.
I will add of the 5 participants in the program, Jem is the first to reach revenue directly from product sales. So that's a huge milestone, and congrats on that. So that's terrific.
Yeah, that provides a lot of confidence going forward, and better sleep at night as well.
Yeah, you did have a few bags under your eyes a couple of our meetings there before you get those checks in. So good job. All right. Lori, are there other questions?
Oh, sorry, I answered one in the chat, Paul.
Oh, okay.
reflexive. Sorry.
Good job, Kristy. All right. So Val, did you have a question? I saw that you.
Yeah, I want to kind of poll everybody here. I want to first thank everyone for letting me join in your journey. It's been a privilege to be working with you, and I apologize to Jason that I did not have, my calendar did not allow me to spend more time with you, but we will follow up. But I think what I'd like to hear is what were your key learnings and takeaways from the BioStartup program? A lot of effort went into developing this program, and we pivoted because of the pandemic. And I'd like to get your feedback. What did you really think was the key thing in the BioStartup program that helped you move to the next stage? So we can basically go across my screen left to right. So Kristy, unfortunately, you're the first person in the left.
That's okay. I'll be succinct because Val, I always say your Rolodex was one of the key resources in this program. I mean, the people you connected us to and the feedback that they gave was really crucial, but also I think it helped us uncover what we didn't know. So there were certain things we needed to do as a company that we weren't even aware needed to be in our pipeline. So we grew a lot during this program.
In one of my presentations, I showed a little pie chart, and the things that we don't know is really 50% of the information. So discovering that was very valuable for you. Mm-hmm. Jem, what are your key takeaways?
Yeah, I mean, starting on this venture, there are so many questions that pop up. You have to really be informed in a broad category of topics, financing and accounting, managing a company, acquisition, marketing. The best part for me was the fact that I had a one-on-one relationship And I thank Paul for that, and also the people that he linked me with, who I could ask all of those questions to, and questions that maybe I didn't even know I should be asking popped up through those discussions. And that was the biggest benefit to me. It would have probably taken me years to really find out the answers to those questions, but it all happened within a few-month period and really accelerated my establishment of the company and actually reaching some revenues.
That's great. Thank you. And clearly the program far reaches beyond. That's great that you saw that as extreme value. Ariel.
Yes, I have really benefited from the BioStartup. I've participated in numerous workshops and programs through the Maine entrepreneurial community and ecosystem. It's been always very, very helpful. But that's about kind of like the nuts and bolts, and the three of you in leading the startup meetings and responding to my questions and concerns. That was just invaluable. It's such depth of background to bring to my questions. You're serving as advisors, available very readily through this program, and with your expertise and experience and good judgment, but also listening to me and reflecting to me, and really paying attention and interacting in a helpful relationship. So the human part and your expertise and experience that you've brought to my experience, very top notch.
Thank you. And Jason.
I think I would echo a little bit of what's been said already. Certainly, I had the benefit of doing the Top Gun program and transitioning from that into BioStartup and working with Paul directly. And I think they were great complements to each other. And a lot of what Ariel was saying, getting foundation, I've said several times on platforms like these, I'm a physician and have no business background. So getting that sort of speed course in that and the foundation through Top Gun, and then being able to pivot into more one-on-one and catered advising has been invaluable. And I think the other thing that happens that I'm certainly guilty of that was incredibly valuable with this is we all have passions and interests in certain parts of the entrepreneurial world and probably less so in other areas. And Paul's been great about making sure that I don't focus only on the things that I love in the growth of the business, but also the necessary. And so that was hugely valuable to me too.
And Jerry, your thoughts?
Well, I think I'd just like to echo what everybody else has said, and won't repeat it. But I also have been through the Top Gun program, and I think through Maine Center for Entrepreneurs Top Gun program, followed with BioStartup, is hugely beneficial. And I think the thing that I've taken away from both of these programs is an appreciation for the depth and the breadth of the life sciences, biosciences environment here in Maine. And I'm confident that it's going to provide the base on which our company is going to springboard off from. I think the BioStartup program, hugely generous amount of time has been provided for coaching and mentoring. I think there are a lot of resources available. I don't think that I have scratched the surface of those, but I am glad to know about them, and look forward to continuing my affiliation with both Paul and Maine Center for Entrepreneurship, and tapping into Val's expertise if possible, and so forth. But just a hugely beneficial program. Thank you for including me.
Thank you, Jerry. Thank you, Jerry. And I do owe you an email, so you will get that. So, and I will close with one quick comment. I've worked in 14 countries over my decades of being involved in healthcare. And the one observation I've walked away from is that really, and I think Susan Ahern said it earlier, Maine really is the new horizon for life science. So I just hope the rest of the people online can spread that information, and those of us who are not in Maine will come to Maine. So Paul, back to you.
Thank you, Val. Thank you, everyone. And I would just echo the fact that I think the primary mission of this program, and not only MCE, the Bioscience Cluster, but BioME is to really harness all those resources to make Maine the new landing pad for life sciences entrepreneurs. There's so many resources. The other thing, the spirit, the enthusiasm this group has had and others, it's just really been really wonderful. Tom, there was one last question that was asked. Do we have time for that, or do we need to move on?
Sure, just one last question would be great.
Okay, so hey, Jim, this is for you again. So this, as you ramp up operationally, do you plan on staying current in Brunswick? Or are you looking for different manufacturing and processing sites?
Well, yeah, I haven't really thought too much about it just yet. It's been such a whirlwind just getting to this stage. I do know that I can stay at Tech Place for a maximum of 5 years. And I felt very welcome here, and will expect that I can grow here for quite some time. Beyond that, I do still want to stay near coastal Maine. It might depend on blood sources where those will be coming from. If it turns out that down East Maine is a better locale for kind of having quicker access or easier access to blood, that might be an option to think about in the future. But we will definitely be needing facilities to grow into. I can see that happening quickly because we've already started renting additional space here in Tech Place.
Terrific. Well, listen, thank you everybody for your time and sharing your stories. They were all terrific, and this is not the end. This is a continuum, so we'll continue to stay in touch and wish you all tremendous success. So I'll end there and hand it back to Tom and Anishka.
Okay, thanks so much, Paul. This has been really great. I really appreciate all the speakers and all of the great testimonials. We really appreciated that. Just by the way, Jim, I have it on good authority that the Tech Place is looking to expand. Actually, the Brunswick Landing is looking to expand and develop a life sciences focused incubator over the next couple of years. So hopefully you'll be able to grow into that space when it comes online. One thing I wanted to point out is between Paul Fitzpatrick and Val Kratzman, we have a great team in place here to help early stage companies. And the fact that we have people like that in Maine that have come here from other places because of the quality of life, really bodes well for the future here. So I'd like to hand it back over to Agnieszka to wrap up and just to say a few quick words about day 2 of the Life Sciences Summit, which will occur tomorrow, starting tomorrow morning at 9 a.m.
Thank you, Tom. I just want to say thank you to all the speakers today. It's been incredible. Also, thank you, MCE, for actually organizing the BioStartup program. I think it's a great asset to Maine and another awesome resource. And I encourage all of the smaller companies to look into that because it's super valuable. Regarding tomorrow, we're starting at 9 a.m., same as today. 9 to 11:30, and you see that face of Juan Enriquez, who we are beyond excited to host as a keynote speaker. We will be starting at 9 with some BioME updates, just to let you know what we've been doing. Then we have the keynote address, and then we'll have another great panel with Jackson Labs, IDEX, the Rue Institute, and the Maine College Community College System. And we'll focus on workforce and some other challenges and success stories related to how the pandemic has impacted the life sciences in Maine.